Everyone in the snow stone moment in the sunshine.
Oh my goodness.
Can we see that on YouTube somewhere?
Yes.
Yeah, exactly.
It's very
Okay. I think it's actually fine. Oh, yeah.
All right, sorry.
No worries.
Yeah.
Desktop if you want to.
What are they? These are, oh, those are,
That's this folder.
oh, okay.
I guess this role, this is role Becky's in any way.
This,
Yeah.
anytime a pop-up comes, I'm like, ah, like that, it's okay. Or,
Oh, he's got this being bumped up. Oh, really?
Sure.
So I learned from.
I mean, I have a PowerPoint if you want.
Yeah, use the PowerPoint instead.
Yeah.
That's probably what it's-
Leave that.
Yeah.
Oops.
Yeah, because I did. One of them lost. It's so hard.
Yeah.
Yep.
Perfect.
So, the slideshow. And start from the
Are they
beginning.
gonna, what is all of that? I just want to make sure that nothing is gonna like automatically start moving for me or anything.
Do you have timings set?
So.
I potentially use someone else's file, so I don't know.
What about,
they-
what's the narrations?
Narrations usually means like the slide like comes in and out like some crazy
want
way.
that?
No, I don't want anything, nothing.
And media.
I don't think I need that either.
Okay, so then from the beginning. Which will be up there and you got your thing there.
Perfect.
Okay, let me start.
Okay, notes, I don't need my notes are gonna distract me because those are mine.
Okay,
Because my name is not Maria.
no? Okay, so all you have to do is hover down here and it'll be up.
And so just wait.
Got it. Okay, perfect.
Well, let
Thank
me
you.
close this up here. There you go.
Perfect.
And we'll do this and let me start the Zoom or else we're not going to be able to.
Okay.
Nobody's going to see it.
Yeah, it's really good knowing behind the scenes, especially when I know what seems to be the problems.
I like it, I know, we couldn't say, we should probably.
He says, if I understand I'm going to do something, so how do we do those? Then we can not go for the Zoom. So just to speed this up.
Do you need to get here?
Pardon?
Do you need to do anything here?
Oh, I'm first, so I'm.
Oh, you're just, okay. I'm
Wait.
going to do this. Share screen. You don't have to worry about sharing the screen or anything. So you're shared.
Okay,
Now all you have to do is put up your PowerPoint.
okay,
Which
and I
is
can
right
do
here, right?
presenter view.
Yeah, we can start it up
Yeah.
right now if you want.
Yeah.
So we'll go here.
Mhm. And
Which
then
one is yours?
Tuesday,
This one? Oh, yeah, okay.
Oh, really?
and then, oh, wait.
Where is?
uh-oh,
Yeah.
for purples,
That's right.
maybe?
Yeah, that's it.
I'm not going to spend. Right after the first time I did it, I think it was-
Chocolate.
There we go.
Okay, I'm the first one.
Make the structure. So it has to be clean group.
And we're gonna share you
And then I said to him, oh, no, I
and bam.
share it with someone else.
Oh, great.
Yeah. So do you want that
Fabulous.
bigger or anything or are you good?
No, that's fine.
Perfect. Then you're all set.
Amazing.
And this is here, so you can utilize this if you need to.
Okay. And then should I, do we need to join?
No.
No, we don't need to do
We're
it.
doing it. We're running audio
Okay,
through someplace
got
else, so don't join any audio on here. We're already sharing the screen, so you don't have to do anything with Zoom. I'm sorry, with Zoom. You just have to start your presentation and then
Okay, so we just started.
just start your PowerPoint and that's it. Don't mess with the Zoom at all because we're running audio through the office over here. So
Okay.
And what's the range like on the mic? Where do we need
Oh,
to
yeah.
stand to go?
you could right here, right where you
Yeah.
are is fine.
But don't move too much.
No,
Okay.
it covers. If you feel more comfortable standing up to the side here or something like that, just bring it over to you and
Okay.
you're good.
Okay. As long as it's pointing at you.
Yes.
Okay.
We're just right across the hall here if you need anything.
Thanks very much.
Thank you. Aisha Arjman. I also have Joe Brown's on my committee.
Joe Brown?
Yeah.
Okay.
And then Angela Harris from state as well.
Joe Brown's just next to me.
Oh, got it. Yeah, I haven't seen him. But
He's around. I think he's been coordinating that out. Hope you enjoying having you on the committee.
yeah, we haven't had a meeting yet. There's just a lot going on.
So this is the one that we said. Yeah.
He's a kind, simple guy.
He's funny.
Yeah, very funny. Just like.
Yeah, you're saying. What is that?
No, I see. Like, what other small talk you get? Yeah.
Things that are really especially from places like those guys.
Yeah.
I mean, shit, but not.
So I just realized that I can't hit for center about and all the numbers that are not mine. So I think I don't need it.
You'll do great.
Yeah, of course. I'm always here. Yeah. I worked for University of Baltimore. I've been with Canada for like over 8 years. But I worked in that treatment with Christine Ho, with Tom Clausen, with all of them. Yeah.
And I was with my yesterday, like, it's going to be great, so thank you.
No, not you, like, it's maybe you.
Yeah, that's your right.
Can you take it? Oh, yeah.
Like, I speaking. Yeah.
Yeah. Oh. Not like action. Wait, when are you guys after me, like,
I'm lost.
it's your last and your
Right.
third.
It's been seconds, not just start.
So, thank you. They told me we can do it.
Oh, you're selfies.
In the interest of time, I think we are going to start. Hello, thank you so much, everyone, for joining us today in this session. Every time I moderate a session, one thing I usually take important is time management. So I would want us to start on time. My name is Dr. Musa Manga from University of North Carolina, and I'll be moderating this session. In this session, we've got 4 presentations, and we'll kick off with the first presenter. That'll be Kathleen Niven from North Carolina State University, and she'll be talking about the effects of weather extremes on fecal contamination along pathogen transmission pathways in rural Bangladesh households. So the floor is yours.
Good afternoon, everyone. My name is Caitlin Niven. I'm a PhD student at North Carolina State University. And today I'm here to discuss an important topic in the world of WASH, which is the impact of climate change on global health. Climate change, according to both the Lancet Commission and the WHO, is one of the leading global health threats of the 21st century. Changing temperatures, increasing magnitude and frequency of precipitation, flooding, and more are all global health risks predicted to increase both morbidity and mortality. A lot of studies have shown increased diarrhea, but we don't necessarily know through which mechanisms or why. So I'd like to dive deeper into the specific intersection between climate change and diarrheal diseases. Our motivation was to provide an understanding of the mechanisms behind increased disease patterns and weather. Research specific to the effects of climate change is difficult to conduct due to the interconnectedness of climate, environment, and health. So, motivated by this gap in research, our study aims to fill the void in understanding the effects of climate change on pathogen transmission through the full set of fecal-oral transmission pathways. Unlike studies that often focus on historical seasons, we are taking a dynamic approach by looking at different intervals of antecedent timeframes. This is beneficial in context as climate change has the potential to shift both timing and duration of monsoon seasons. So understanding the granular complexities in weather patterns poses as a valuable measure. And lastly, our study was conducted in Bangladesh, which is particularly vulnerable to climate change due to its geographical location and topography. So the objective for our research is clear: to compare E. coli levels in various environmental samples following periods with and without extreme rainfall and temperature. This allows us to target the pathways at highest risk of contamination, which will aid in the identification of those in need of interruption and subsequent intervention. So now I'd like to dive into the heart of our study. Our canvas was vast, stretching across households enrolled in a WASH randomized controlled trial in 4 districts in central rural Bangladesh, known as the WASH Benefits Bangladesh. A total of 1,840 households were visited by field staff once, and 720 households were visited an additional 8 times. Through longitudinal sampling conducted over 3 years, we collected over 26,000 samples spanning 8 environmental compartments, capturing a very comprehensive picture of fecal-oral pathways. And finally, we used IDEX Quantitre 2000 to enumerate E. coli. So this is our adaptation of the F diagram, which is a conceptual model commonly used in environmental health and epidemiology to illustrate the movement of pathogens across fecal-oral transmission pathways. So this figure depicts the transmission routes explored in our study, starting from the top: tube wells and ponds, courtyard soil, captured flies, mother and child hands, stored water, and stored food. So to connect our WASH data to historical weather, we pulled daily local weather data from 2 sources: Glow H2O's MSWEP with a 0.1 degree resolution, and NASA's FLDAS Central Asia with a 0.01 degree resolution. And using data sets for our entire study period, we spatiotemporally matched daily average rainfall and temperature data to samples within our WASH data set using closest Cartesian distances with available GPS coordinates. And once we matched those data points, rolling averages were generated for 5 different antecedent timeframes prior to sample collection for use in creating categorical weather classification variables based off of cutoff values from literature. And additionally, daily maximum values were used to determine whether heavy and extreme rainfall, extreme heat, or a heat wave occurred during that antecedent window. Our statistical modeling approach employed a negative binomial regression model with robust standard errors to account for cluster randomization and the geographic proximity of study blocks. And we pooled the data across study arms and the 9 longitudinal visits. We also adjusted for additional covariates, so rainfall models controlled for temperature within the same antecedent timeframe and vice versa, as well as potential confounders. Confounding variables such as family demographics, income, housing materials, or the presence of a domestic animal were all collected at the time of sampling. So now I'm going to take you through the visual representation of our findings, which is the forest plot. So if I can get the, okay, great. First, as you scan across the forest plot, the dots represent estimated adjusted E. coli count ratios. Horizontal lines represent 95% confidence intervals. If a line crosses the horizontal or the vertical axis at 1, it suggests no effect. And then points to the left or right of this line suggest a decrease or increase in E. coli ratios, respectively. So starting from the top, we see the 8 different sample types categorized. So the first 4, stored water, food, mother hands, and child hands, represent pathways commonly found within the household. And then the next 4, tube well water, soil, ponds, and flies, represent pathways exposed to the ambient environment. The left-hand y-axis shows different intensities of rainfall from some to heavy to extreme, which were all compared against the reference group of no rain. And then on the right-hand y-axis, which is kind of cut off, but we have the temporal element. So these are the antecedent look-back periods prior to sampling. And for our analysis, this ranges from the day of to 2 weeks prior to sampling. And this dimension is actually really crucial for understanding immediate effects of rain, but also lingering impacts over time. And then finally, the bottom axis illustrates the E. coli ratios. And just to note, each data point on this plot represents a specific combination of sample type, rainfall intensity, and look-back period, providing a nuanced view of how these factors interact. So rainfall. As I mentioned, we created categorical classification variables of rainfall compared them against the reference group of no rain. We found that the effects of rainfall were, they varied across the different pathways. So controlling for temperature and other potential confounders, extreme rain on the day of sampling was associated with higher E. coli counts in stored drinking water, food, and ponds compared to no rainfall, as evidenced by most of these data points laying to the right of the null association line. For most pathways, effects were similar when rainfall occurred 1 to 7 days prior to sampling, and then attenuated when they occurred 2 weeks before sampling. And then we found extreme rain decreased contamination in source water and soil, the effects of which were similar 1 to 7 days before sampling and slightly attenuated 2 weeks prior. And lastly, we found extreme rainfall did not have any consistent effects on mother hands, child hands, or flies. So moving on to temperature, we generated categorical classifications of median and above temperature, as well as extreme temperature. And these categories were compared against the reference group of below median temperature. So controlling for rainfall and potential confounders, extreme temperature on the day of sampling was associated with higher E. coli counts in stored water and food. The effects on stored water and food were similar across all of the antecedent periods we considered. And we found extreme temperature decreased contamination in soil 1 to 2 weeks prior to sampling. And like rainfall, we found that mother and child hands were not consistently affected by temperature. And finally, it's important to note that we could not estimate the effects of extreme temperature for source water, ponds, and flies because there simply weren't enough samples collected on days that experienced extreme temperature. So our study boasts significant strengths. Over 26,000 samples, longitudinal measurements over the course of 3 years, which capture diverse weather conditions not specific to monsoon season, and a comprehensive examination of fecal oral pathways. But our study also has several important limitations, including the challenge of generalizing these findings to other low and middle income countries. Weather effects on environmental contamination may be different in settings with different meteorology and hydrogeology. Weather effects on fecal oral transmission pathways may also vary in urban or densely populated areas and settings with varying access to WASH infrastructure and waste management practices. We are also assuming that our weather data is accurate. This is a more reasonable assumption for temperature rather than rainfall because it tends to be more heterogeneous at a provincial scale. So our weather data may not exactly reflect the conditions at our sampling sites. And lastly, we measured fecal indicator bacteria, which may behave differently in response to environmental stressors compared to non-bacterial pathogens. So in summary, extreme rainfall and temperature increased E. coli in stored water and food and decreased E. coli in soil. Extreme rainfall also increased E. coli in ponds and decreased E. coli in tube wells. No significant effects were identified for child and mother hands. Ultimately, understanding these nuanced effects is crucial for developing targeted interventions in rural Bangladesh. Interventions occurring up to 2 weeks following an extreme rainfall or temperature event must consider specific transmission pathways to effectively interrupt pathogen transmission. We believe the implications of our research are clear. Measures to control enteric infections in rural Bangladesh following extreme weather should prioritize reducing contamination of drinking water and food stored at home and minimizing exposure to contaminated ambient waters. Finally, I would like to take a moment to recognize all of our partners who made this research project possible. And again, my name is Caitlin Niven, and I really appreciate your listening to my talk. Any questions?
So thank you so much for that great presentation. We'll have time for about 2 or 3 questions.
Now is it on? Okay, great. Caitlin, thank you for that presentation. It's a really awesome analysis. I just had a question about your definitions of antecedent conditions, because in the analysis we've done in the past, we've thought more about the antecedent conditions being, so my understanding is the way that you've defined it is like sort of more like lag effects, like up to 7 days, whereas the antecedent conditions we've done in other studies, we've really looked at longer time periods to consider, has it been dry or has it been wet when the rainfall occurs, extreme rainfall occurs. And we've found that that's been more impactful than just sort of simple lag effects. And so I guess I was just curious if you'd considered that. There's a whole review on that approach in Cray et al. That you might consider.
Yes. Oh, yeah. No, I'm familiar. Yeah. So I think we wanted to take a different approach to this analysis in the hopes that this could be implemented in a short period intervention scenario. So we did consider looking at dry versus wet and how many dry days prior to extreme rain or heavy rain. But ultimately, for the sake of this analysis, we wanted to keep it pretty immediate and just look at different cutoffs in terms of, how many millimeters of rain and how many degrees Celsius increase or decrease.
Yeah. I mean, you might just look at the other because it might,
Oh,
you might, other interesting things might come out.
Absolutely.
Because we have found it across a bunch of different studies.
thank you.
Thanks.
Hi, thanks for the presentation. Really impressive work. Okay, too short for this. My name is Rana. I'm from IDE Cambodia. We've done a similar type of study with households in a sense of trying to link climate vulnerability and increased specifically of flood-prone areas and increased rainfall towards what that means for sanitation systems. The link that we found primarily was with the increase of climate change and extreme rainfall events, that sanitation systems are more likely to fail, or at least the ones that are currently implemented. That led also, not directly, but we found some relationship as well with behaviors of households emptying their pits, like unsafely, for example, during those flood-prone events or rainfall events to regain that functionality of the systems. So I was kind of interested to see, one of the results that you mentioned was that with those increased events, you found that there was lower soil contamination, while I guess I would have assumed potentially the opposite, assuming that people would actually, or, might be, for example, doing some behaviors that are unsafely, like doing that. But I can see also that dilution and things like that could happen. So I'm just wondering, from your current research and, for example, our findings, what do you think could those factors be? And if you have heard of anything around also sanitation systems failing and behaviors around those rainfall events. Thanks.
Sure. Yeah. So I think our primary assessment of, soil having decreased E. coli contamination was mainly just this washout effect. We saw an increase in ponds. So we kind of assumed, well, if it's not in the soil, that maybe it'll go into the ponds. And then we did find that association. But in terms of behaviors, I'm not very familiar with the exact behaviors that were observed within this study. However, in future studies, I would be interested at looking at, how do these individuals behave when there has been extreme rain? Are they more or less likely to be inside or outside? I think the fact that we didn't find increased contamination rates on mother and child hands was also interesting, because if you think of mouthing behavior with children, I would have assumed that there would be increased rates of E. coli. So again, in a future study, I think it would be really great to look at different behaviors, but that's not necessarily something captured in this study.
Something like cycling would have, interesting in this factor, you can have over and over, but in the interest of time, what the next presents are. All right, we're going to have a chance to travel to the UK in part of Leeds. Get some of the superstars from there to talk to us about financing climate adaptation of urban sanitation and heating. And that will be Leonie Hyde-Smith.
Thank you. So I'm today presenting some research that is based on a paper that I authored together with Shojan, Dr. Katie Röhlich, Professor Anna MD, and Professor Barbara Evans. And maybe to start with, just to untangle the topic a little bit, like why did we think it is important to look at these equity implications of financing climate adaptation of urban sanitation? Let's start with climate change. Climate change is absolutely not fair. Not everybody is equally affected, and also not everybody has equal resources and capacities to cope or adapt. Moving on to urban sanitation unfortunately is also not fair. We know that urban sanitation service provision has some structural inequities and is often shaped by historic investment decisions and also those based on colonial legacies. And then finance, money is never fair. So as we know, money kind of like the investment priorities are again like driven by political agendas and also influenced by local and global financing institutions and private capital lenders. So it was a very cheerful introduction, wasn't it? Let's move to our approach. So we use document review and key informant interviews, and we didn't do a systematic or complete review, but we purposefully selected cases that we think really helped us to map the space in which investments into sanitation adaptation are currently happening. And we looked at 8 investment cases in detail. And so we wanted to include cases from different geographic regions and also from different country income classifications. And we also purposefully searched out for different financing approaches. Then also we included different infrastructure scales and sewered and non-sewered sanitation examples. And we also wanted to look at investment that target different parts of the sanitation service chain. So for example, this is the list of cases that we finally chose. And if we look at this example from Miami-Dade, this is a septic to sewer conversion, and that obviously affects most directly the containment and the emptying and transport part, whereas the example of the Sponge City program in Wuhan, this is a flood resilience or drainage program, and that has an indirect effect on the entire sanitation service chain. So yeah, what did we find? First of all, there's absolutely no innovation in the funding of sanitation adaptation funding. And I think the sanitation people, we are sometimes a little bit sloppy how we use terms, is the source of money. And then financing describes the mechanism of payment. So no matter how innovative these financing approaches claim to be, and spoiler alert, we actually found that the innovation side was mostly a little bit exaggerated. There is no magic money tree, and therefore the sanitation adaptation will be paid for by the traditional sources of sanitation funding, which are tariffs, taxes, transfers, and household investments. And so then we found that obviously these climate adaptation projects of urban sanitation are often huge investments, and there's mostly some form of debt financing involved, and then these will be repaid, often recovered with tariffs. So we had to look into what are the equity implications of that. To do that, we looked into the socioeconomic equity and also the intergenerational equity. And starting with the socioeconomic side, there is a structural issue with the repayment of debt via customer bills, because customer bills are regressive. And so people with lower incomes will be burdened more, or proportionally burdened more than people with higher incomes. And traditionally, this could be then where public funding could come in and actually relieve lower income households. But we found that public funding support is almost everywhere declining. So then water utilities or water and wastewater utilities are left to their own means, and they have actually quite limited ways of redistributing the costs. And we found actually really only very diffuse and vague claims for affordability considerations in these investments. Also, we found that the affordability criteria that were applied were often quite ineffective to deal with the vast income disparities in these cities, such as London or San Francisco. And as a result, water poverty is becoming a more and more pressing issue, also in high income countries. And if you are interested in this topic, you should actually talk to Ruth, who's sitting over there. And she is co-editing a special issue on water equity in high income countries in WASH. And and the submission deadline is in December. And speak to Ruth. Always a good thing to do. Last point on the socioeconomic side, we've also found that, particularly actually for the US cases, that in many places there were quite strict limitations, legal limitation to cross subsidies. So that was also not a way to redistribute the costs. Moving to the intergenerational side, we looked at the perspective of current customers and then also future customers. Current customers actually might pay with their tariffs, which is a service charge, long before they see any improvements in the service. For example, customers of Thames Water in the UK, they have been paying with their wastewater tariffs, with the water tariffs, for years now for the construction of the Thames Tideway Tunnel. That's a big tunnel structure under the River Thames. And before there have been like any improvements to the combined sewer overflows into the River Thames. From the perspective of the future customers might inherit these mounting debt obligations that the water service providers are accumulating, and that already forms quite a large chunk of the monthly customer bills and some utilities. And finally, we also found concern that there, particularly with these quite prestigious resilience or adaptation projects, that they are pushed through without appropriate accounting for the life cycle costs. And this is, for example, a concern in the sponge city investments in China. Now turning onto the global scale and more like a focus on also adaptation, sanitation adaptation in low income countries, there obviously equity considerations also need to take into account the discussion about the historic contributions to climate change. If sanitation adaptation is paid for, is financed by loans, the repayment obviously adds to the sovereign debt of countries, such in our example, that was Zambia. These countries are often already highly indebted, and these climate adaptation loans then further strain their ability to invest in basic services for the population. So, and at this point, it's also quite important to deconstruct this mysterious creature, climate finance, and what it can do for the sanitation sector, because currently the majority of public climate finance is provided with is repayable finance, so loans again. So we then moving to another topic, and that's actually how green are these investments really. And we found some indications that some investments use climate resilience or friendliness kind of more as a branding tool, likely to bolster the reputation or add legitimacy to these investments. For example, the Lusaka sanitation program has been criticized for having a strong bias in the investments into centralized sewer systems, and will thereby exclude, or at least like not enough enough benefits to people living outside the sewered areas, and that's the majority of people living in lower income areas. And that example, some donors actually used climate resilience quite prominently in the title of their investment package descriptions, and others didn't, even though their packages are actually quite identical. And such greening, or if you would like to say greenwashing, is not only cannot only be observed with the kind of project titles, but also with the finance. And we couldn't find any evidence that green or climate bonds made the repayment or the conditions any cheaper or beneficial for the service providers. In fact, despite green or climate bonds are also often like cited as being an example for these innovative financing mechanism, they are very similar to regular bonds. And in some cases, there have been even like irregular bonds that have been retrospectively been then declared as green without any changes in the conditions. So that's, for example, happened with the Thames Tideway Tunnel. So currently, green finance in sanitation adaptation is mainly beneficial for fund managers and investors trying to green their portfolios, but has no real benefits from a provider or customer perspective. Coming to our main messages, equity needs to be actively addressed in climate resilient sanitation investments, otherwise they become inequitable. And given the huge societal benefits of sanitation and the global challenge of climate change, a public sector funding approach is most appropriate. And that means that there should be like a refocus on general taxation for the instead of tariffs for the funding of these projects. That would allow a more equitable distribution. And for lower income countries, there is actually an increase in transfers needed. And Dr. Ruth.
Thank you so much. Thank you for the presentation. In the interest of time, we'll have at least one question, and then we'll move to the next presentation. Question, what's the question? So that's an interesting topic. I wanted to ask, but then I'll be like.
I wanted to make sure nobody else had a question before I went up. Great presentation. This is not my question, it's maybe rhetorical, but are you saying that low and middle income countries should not look up for all the solutions that are currently in developed countries? So yeah, it's a great, I think, way of presenting, some of the maybe rebranding or relabeling of green and climate financing that we're seeing today. And I think a chance for us as a sector to kind of think through what are the ways to come in and really think of putting equity in these kind of things prior to designing these innovative way of saying things like climate financing. But yeah, I'm curious from your main messages, if there's any kind of other context or thinking through what could be another recommendation that you see in terms of now climate financing for just low and middle income countries when it comes to WASH systems and how to incorporate climate financing into it. I know it's a big question, but just from what you've learned of, like, let's say what not to do and what are some of the ways that we can think about, let's say even in designing or at the steps prior to kind of getting into a system that's so complex and kind of complicated and realizing that we need to potentially backtrack or
sorry. I think there's like no total answer, and I'm not saying that kind of like the loans or bonds are generally wrong for like any country. It's just I think like quite shocking if you look at if you look at the climate finance and then the kind of like untangling of it and see how much of it is actually kind of like repayable, and particularly in the adaptation space, it's just difficult because these projects don't really generate like necessarily like income. So yeah, but I think it depends, and there needs to be obviously there needs to be a mixture of kind of approaches, but I think it's just important to state that the focus needs to change a little bit into like a different direction.
Okay, I'd ask for one question. It seems like so many people want to ask you questions, and because everything is unfair, as you told us, two people ask 1 minute. Use 1 minute. We can move further.
Thank you very much for the privilege. Good presentation. I just want to ask, just being curious, you said in Zambia, no, the one she presented.
Yeah,
You said the country is still servicing debt. And I was wondering till when and what is the hope for financing even projects that relates to what you are doing? If all they are doing till now is servicing debt, then what's the hope for, giving funds to the project that you propose to do? Thank you.
I think that's quite similar to the question before. I think that I mean there is no easy answer, and I think there needs to be a mix. And I can't solve the debt problem of Zambia. I'm sorry.
Thank you so much. I'll take 30 seconds. I love the presentation. My name is Deepa. You mentioned transfers as a solution. I'm curious, transfers are untied, right? Doing tight transfers is politically very complicated because it goes against the ethic of a federated structure. Do you know of good examples, as you did your case studies, where transfers that were tied to sector investments or performance or norms-based evolutions worked?
No, we didn't have any case involved, so sorry.
All right. So you shouldn't worry about time. I still have a buffer that I'm giving at the moment. So I'm still within time. So we can have the next presenter. We're going to hear about some work done in Zimbabwe. That will be Kerry Alexander, but she'll be talking to us about cost evaluation, examining sustainability outcomes in the Chivi WASH program. So the floor is yours.
Thanks, Moses. So I'm Kelly Alexander. I work with CARE on the Water Plus team as a senior technical advisor. And I'm here today to talk a little bit about our Chivi WASH project that we did in 230 villages between 2014 and 2017. And our key activities, as you're probably not surprised, were drilling boreholes, rehabilitating boreholes, strengthening water point committees, training village pump mechanics to fix the water points. We also implemented SAFP, which is basically the government of Zimbabwe's version of CLTS. And then we also worked a lot with latrine masons or actually establishing latrine masons in the communities where we were working. We did gender trainings with stakeholders and we did government engagement specifically at the district and ward levels. And some select results from that project. We increased household access to drinking water. We drastically decreased open defecation and we increased latrine ownership by quite a lot between 2014 and 2017. And a third-party evaluator came up with some lessons learned. This was as part of the final evaluation document that they put together. So multi-stakeholder participation was really important, not only looking at government officials at all levels, but involving them at all the different phases of the project cycle. And also when we worked with different stakeholders from the community or from, latrine masons or government, we tried to make clear whose role was whose responsibility was what time would be required. And when it came to latrines, for example, what investment might be required by community members. Participatory project monitoring was really important, as well as feedback mechanisms. We did awareness sessions with different stakeholders, as I mentioned. We did some ODF celebrations. People really appreciated that. Identifying local champions and involving traditional leadership from the onset of the project. So these were just some takeaways from that, the CWP project. And so this evaluation that I'm presenting on today, the expert evaluation, was funded by the Bill and Melinda Gates Foundation. I don't even know if you knew that you paid for it, but you did. Yeah, so thank you. After the project ended in 2017, 4 years later, we went back to see whether WASH outcomes have improved, remained stable, or diminished over those 4 years. And so what did we do? We did 315 household surveys. We did some observations. The district water office also maintained some records of ODF status. So we were able to review their data as well. And then of course, we did some semi-structured interviews with village heads, water point committee members, village pump mechanics, etc. So what did we find? Basically, all the graphs I'm going to show you today look kind of like this, where baseline was here, end line was here, and then ex post was here. So a little bit lower than end line, but not as bad as baseline. And then just to show here, this graph is showing proportion of households that own a latrine. It's important just to point out that only 1% of the households that we talked to reported any maintenance or upgrades made in the last 1 to 5 years. So I don't know whether that number is going to just continue to decrease, basically. In terms of open defecation, it was 40% at baseline. CARE Zimbabwe got it down to 1% in the communities where they were working. And then in 2021, it was up to 8%, which is pretty good, honestly, for open defecation. Like the fact that we only went back to 8% from 40% is pretty fantastic in my view. And then of course, the reasons were not surprising. An extreme weather event knocked over the latrine, people never rebuilt it. And then the pie chart here just shows in 2021, what sanitation facilities households had. So B VIP is Blair VIP, and then U VIP is upgradable Blair VIP, and those are just designs, VIP designs that the government of Zimbabwe stamps. So if you want to learn more about a Blair VIP, you can do that. Okay, so looking at household latrine use, which was defined by us as where household members normally go. So household latrine use was associated with the household head being male, with respondent feeling safe toileting at night. And most of our respondents were women in these surveys. The household having gender separate toilets. COVID-19 not impacting the water supply, because this was done in 2021, so we were talking about COVID-19 a lot. And then having access to an improved water source was also associated with household latrine use. What influenced, well, okay, we defined hand washing behavior as somebody who washed their hands as somebody who said they always wash their hands with soap at critical times. Now that was indicator that we sort of use by taking different questions of the survey and putting it all together. But I would say that's a pretty strict definition of, yes, I wash my hands. And that was associated with access to an improved water source, COVID-19 not impacting water, hand washing knowledge, and having an improved latrine. So what here again is the graph. You see a baseline household access to improved drinking water was 72%. It went up to 94% at 2017 and then went down to 86% at ex post evaluation time. And here we can also note that 85% reported that they have sufficient quantity of drinking water on a daily basis. So when we talk about repairs, 34% of households reported that their community water supply was repaired in less than a week. And 63% of the households regularly pay fees to their water point committee. We got to talk to 5 village pump mechanics, and 4 of them are still active. They do have challenges with getting access to tools and getting access to their spare parts that they need for their borehole fixes. And then also the challenge that it doesn't actually make enough money. They have to do other things as well. The vast majority of households do have a water point committee managing their water supply. They're mostly satisfied with that service. And the water point committees are mostly still functional. And by functional, I mean meeting regularly and having a budget. So in conclusion, for our key WASH outcomes, which are WASH access, water access, ODF, latrine ownership and use, and hand washing, things only got slightly worse in 2021. So 4 years after the end of the project. So we think that was pretty good. We're pretty excited about that. And so with these results, we had, I think, 11 or 12 dissemination meetings within Zimbabwe. And I'm going to share a couple recommendations. How many minutes do I have? Okay, good. I have time. Okay, so our first recommendation, and it wasn't just a recommendation that we told the government here, do this. We just said, let's talk about this. Let's talk about if you've seen these challenges, let's have an exchange. And higher quality latrines, of course, came up, but also establishing from the beginning of a conversation with a community or with a household that rebuilding a latrine and maintaining a latrine is probably going to be necessary. The same way after an extreme weather event, you might patch your house or rebuild part of your house, and it's going to be the same for your latrine. And then with latrine masons, thinking not only about them having training on how to build one design, but maybe different designs for different types of soil, different designs for different budgets. And thinking about financing, of course, a lot of countries may not want to do subsidies for sanitation, for household sanitation, but we know that it's hard sometimes to reach the last mile people, thinking about how we're going to target subsidies, how we're going to choose those people who are targeted with subsidies. And then developing a post-ODF strategy and having an action plan is definitely something that should be happening, because a lot of countries have their ODF strategy, and a lot of you probably know it's relatively
easy in some places to get to ODF, but maintaining it is where the challenge happens. And so thinking about what do we do, who does what after we achieve ODF. And then this came from the village pump mechanics and the water point committee specifically, and talking with the government that there's a challenge finding spare parts. Maybe they should stockpile them at the district office. Maybe there should be bulk purchase of supplies for latrine building, so transport is paid by everyone. And so then, the prices of all the different items go down. And then, of course, probably this comes up in every talk, establishing stronger coordination mechanisms between government stakeholders, but also between the community and the government. And then this wouldn't be a CARE presentation if I didn't also recommend that we need to do more social norms change and think more about what barriers we can address to promote women in the wash space, not only as artisans, not only as latrine masons and village pump mechanics, but also as decision makers and leaders. So thanks.
So thank you so much for that presentation. I think we have time for about 2 questions.
Just tell us there.
Can you use the microphone for one?
You said something really interesting about the fact that that 80% of people had not had to maintain their toilets in 5 years, right? Or some very high number.
Nobody reported spending any money. Or spending any money, I think was the actual question on the survey. I'm not sure.
Okay.
If it was money or like effort.
Okay.
That might make a difference in what you're asking.
Maybe, but if like a bunch of toilets fell in also because there was storms, rain.
Yeah.
So then how does that all kind of, so then they just, is that the percentage that went into?
So I guess I didn't present on it, but there was community level ODF.
Okay.
And then there's a household latrine ownership.
Okay.
And those are different.
Okay, so the household latrine, if they didn't spend money on it and their toilet fell in because of the rain, then they no longer have a toilet.
Probably.
Okay.
Yeah.
Yeah, did you examine any effect of like the extreme hyperinflation that was going on at that time?
In Zimbabwe?
Yeah.
No.
All right, thank you so much. Okay, so we're going to have the last presenter, and that's going to be Jonathan from the University of Leeds. And we'll be talking about understanding the cost of improved manual pit and latrine emptying and transport services. Interesting.
I hope so. Whoa. Spoiler alert. How are we looking? Yeah, great. Okay, so hi folks. Thank you so much for sticking around to the end. I knew I was going to go last at the end of the day, so I'm going to try and keep it as entertaining as possible. And I realized that I've gone into best man speech intonation already, which I was really trying to avoid doing. When I was sitting there, I was thinking, oh, like I've got the slot after lunch, after everybody else has spoken and they want to be entertained, and I'm making it worse now, so I'm going to stop. My name's Jonathan Wilcox. I'm a PhD student at the University of Leeds with Leonie, and I'm studying urban sanitation economics. And overall, my objective has been to produce information and evidence that's useful for city level decision makers. And today I'm going to be presenting on the cost of providing a specific type of sanitation service. So I've got 4 main takeaways from this research. The first is that in contrast to previous studies that have focused on single service providers, I found that the cost varies notably between households, both in terms of how any given business provides the service, but also in terms of factors specific to each household. Second, I found that previous studies on mechanical emptying have highlighted the cost of vehicles, but this study found that emptiers' wages are the largest cost for improved manual emptying. I think that's no surprise. Third, that there's often a focus on scaling service providers, and I helped moderate a side event this morning exactly on this topic, but in the study, the data shows that once service providers are operating at a reasonable scale, so doing more than a handful of jobs per week, fully utilising their assets is more influential to cost than scale. And fourth, and this one's a little bit more complicated, it's about attention in the system of providing this service, that there is a tension between households and service providers around frequency and volume. So other research has shown that households have a preference for frequent and lower price emptying, and this helps them to manage household expenses. But to minimise cost, which might be the objective of service providers and city authorities, the opposite is true. Less frequent and high volume emptying is lower cost in the long run. So we're in the sanitation room, and I know we're all familiar with the need for safely managed sanitation in cities and this diagram, so I'm not going to name it. And I expect we're all familiar and recognise the need for improved manual pit latrine emptying in informal settlements in fast-growing cities, particularly in sub-Saharan Africa, and that's the focus of this study. So improved emptying services are generally provided by the private sector and are often supported by the city or an NGO like Water for People, but those services are often unaffordable, unavailable, or inadequate for most households. And there is a big challenge to increase coverage of improved emptying services that are safely managed, financially viable, and inclusive of low-income households. And I really like this PIC2 conceptualization of the problem developed by Ian Ross, where it's a challenge for services to satisfy all three. And in this situation, the private sector can only do so much. So there's a need for city authorities to get involved. But like many situations, they lack data and information to make decisions, and there are two ways that I hope this study can be helpful. The first is in understanding the economics of service delivery, and secondly, in identifying opportunities for cities to support service providers to lower costs. So using data collected by Water for People from 20 service providers in Kampala and Blantyre, I've been able to look more closely at the cost of providing improved pit emptying services. And at this point, I want to say a big thanks to Yvonne, Carlos, Tom, and Julita for sharing the data and supporting me in the analysis, and their consultants, the Phil, for their role in designing the original study and collecting the data. Okay, Barbara, you ready? So to make the analysis useful for city authorities, I used total annualized cost per household as my main unit of analysis, and this was developed by some of my colleagues at the University of Leeds, or TASH for short. Okay, British people. And in the UK, TASH is slang for moustache. Now, I'm going to use this acronym a few times throughout the presentation, so I wanted you to remember it. There are a few reasons why TASH is useful for this analysis. First, costs are spread over the years, and this is important for accounting for vehicles, but it's also important for taking into account that not all systems are emptied at the same frequently. Secondly, TASH is expressed per household, which is useful for comparing between sanitation systems, but it's also really useful for city authorities and their planning. Third, costs are converted to international dollars, which was useful in this study because it allowed us to use data from different years and also to compare between countries. And fourth, TASH uses standard cost categories and a pro forma to ensure all costs are captured. And this provided some rigor to organizing the secondary data and analyzing it. And like Leonie, I'm going to plug my mates from the University of Leeds. So if you'd like to know more about this concept and the project that it comes from, please come along to their side event on Thursday after lunch, and I'll share the details for it again at the end of the presentation. Okay, so on to the main findings from this analysis. First, there's a lot of cost diversity amongst service providers, both in terms of their business model and how they deliver services. So this is things like what kind of customers they work with, the equipment and the types of vehicles they own or rent, what scale they operate at, and how far they have to transport sludge. But it's also in terms of the unit costs that make up TASH, so how much they're paying for vehicles, how much they pay their staff, those kind of things. Second, emptiers' wages are the biggest cost component of TASH. Third, there are three things that really influence TASH. And remember, that's the average cost for each household of emptying spread over the years between when their pit is emptied. So the three things are how well utilized vehicles are, how frequently pits are emptied, and how much sludge is being emptied. There's a lot of fixed costs associated with emptying. And spreading these costs across as many jobs as possible helps to lower TASH. This means emptying large volumes of sludge as infrequently as possible. Fourth, that although mechanical emptying with an exhauster truck is much higher much higher tech, manual emptying is higher tax than mechanical because more labour is required and it is slow. So fewer jobs can be completed in one day. That's really important. And lastly, that it's cost effective for small service providers to rent vehicles, but once a service provider is consistently averaging more than one job per day, it's cost effective for them to buy a vehicle and repay a loan. So this is when scale starts to become interesting. I'm just going to leave those there whilst I get my words. Okay, so back to the city and city decision making. There's a handful of implications from these findings. The first is really obvious. Improving services increases TASH. And this is mostly the cost of transporting sludge to treatment. And a little bit of it is for registering with city authorities and complying with local regulations and managing services and establishing a professional brand. And actually quite a small bit is for PPE and using methods that are more hygienic. But the problem is that these additional costs are transferred unevenly to households in several different ways through different prices for the same service. For example, households that live further away from treatment or the disposal facility are typically charged higher prices. This likely leads to some households not using improved services. And please, people are nodding. The second is that on this point, just to build out a bit more, passing the full cost of transporting sludge directly onto households is unfair because the benefits are shared across the community and the city. The other factors influencing TASH, like emptying frequency and volume, also cause differences in TASH between households. So secondly, whilst labour is the largest cost, uptake of emptying technologies that are faster and more hygienic has been relatively limited. And manual methods are often still preferred by many service providers because they can be faster, handle thicker sludge, handle sludge with higher trash content, and can be formed more safely than informal methods. So we should really recognise that pits are challenging to empty and often cannot be emptied safely at all. One way to reduce emptying costs would be to improve latrine construction, and that would allow technology to be used that is faster and easier, but also safer and more hygienic. So thirdly, many of the businesses surveyed are still establishing themselves and not making effective use of their vehicles and equipment. And so this means that TASH is higher than it could be, which obviously influences prices and may further exclude households from using improved services. So service providers are in competition with each other and don't have a reliable pipeline of emptying requests and work. And this makes it hard for them to fully utilise their vehicles and other investments and lower TASH as much as possible. And fourth, just quickly, as I mentioned at the beginning, there is a tension around minimising cost by emptying as much sludge as infrequently as possible, because low-income households prefer lower price frequent emptying to help them manage their budgets. So in conclusion, and trying to propose options for cities and city authorities to increase coverage of improved services by minimising costs specifically, they can recognise that the cost is unequal between households and do something to share costs more equally, perhaps even citywide. I really wasn't expecting that to do that. What a win. And that beyond supporting service providers, they can support households to improve latrines and make them more accessible for emptying to help reduce costs. And I'm really pleased to have learned that KCCA in Kampala are already starting to do this by subsidising the substructure of toilets. They can also support businesses to fully utilise their assets by securing pipelines of work. And they can understand that there is a balance required between emptying volumes and frequencies that match household budgets to help minimise costs. Okay, so thank you very much for listening. And I want to thank all of my collaborators on this analysis. I'm planning to share more specific details from this in a journal article in the future. And I'll leave the plug for the session on Thursday on the screen.
Thank you, Jonathan, for that presentation. As I promised that I'm very good in managing time, we're going to have at least one or two, time for one or two questions. So I can end the session. Questions? What about TASH and empty?
Hi, Jonathan.
Hi.
I'm Jane. I'm from Castalia. And I did my PhD here at UNC with Dale Whittington.
Okay.
But so thank you for presenting this very interesting presentation. Right now, me and my team at Castalia, we're trying to answer the question, how can we finance citywide scheduled desludging?
Mhm.
And a big portion of that is understanding the revenues and the costs associated with manual and mechanical pit latrine emptying and transport services.
Yeah.
And I understand, that you've looked at the costs, but do you have any sense, how the costs compare with the revenues, and if these private enterprises are profitable?
That's a really good question. I would say two things. So the first is that pit emptying businesses universally are profitable. If they're not, they go out of business and you don't see them anymore. So it comes down to the quality of service that they're providing. This study is about improved manual pit latrine emptying. And I've been quite cheeky using this term improved because I haven't defined it and nobody else has either. And I'm using it vaguely to mean services that are recognised and licensed by the city. Several other studies have looked at similar service quality levels and established the willingness to pay for the service and the cost of providing the services. And generally they find that willingness to pay is about 20% or less of the market. So if you're thinking about cost and revenue, there's a big funding gap. And I'm talking funding in the way that Leonie mentioned it earlier and not financing gap. And actually, if you want to know more, there's a guy at the back, Zach Burt, who did a study specifically on that a few years ago. Does anyone else want a plug? Yeah.
All right. We can have the last question for you.
Thank you, Jonathan. That was amazing.
Right.
You mentioned that sort of the utilization of vehicles is an important driver of cost. So one of the things, and we've seen some of that in some of the work we've done as well, which is the role of the public service authority, regulation and demand aggregation could be a powerful role they play outside of providing direct public finance. Just based on your analysis, what are some of the other things like for governments to consider as they're intervening in the emptying markets outside of providing direct subsidies that could help change those cost curves?
That is a great question. A digital app. Yeah, I think I didn't think about that at all in this study. I concentrated as much as possible looking explicitly at the cost and only the cost. But there are, off the top of my head, I don't want to list a bunch of options, actually. I can't think of any at the moment. But you're right, there's loads out there and people are starting to study them. Yeah.
Thank you.
Sorry.
Okay.
Yeah.